They're sitting in your medicine cabinet right now. Prescribed with good intentions, taken daily, even recommended by doctors. But what if I told you that some of the most commonly used medications by seniors, yes, the very ones you or a loved one might rely on, have been scientifically linked to memory loss, confusion, and even full-blown dementia? Today, we're pulling back the curtain on the 6 medications that could be silently sabotaging your brain health. If you're over 60, or care for someone who is, this is a video you cannot afford to skip. Let's dive in before it's too late. The anticholinergic danger, the silent memory killer. For many seniors, anticholinergic medications have been a regular part of managing everyday issues, like allergies, bladder control, and even depression. They include familiar names like diphenhydramine, found in Benadryl, or oxybutynin, often prescribed for overactive bladder. On the surface, they may seem harmless. But here's what most don't realize. These drugs block acetylcholine, a crucial neurotransmitter in the brain responsible for memory and learning. In younger individuals, this might not cause immediate concern. But in seniors, the stakes are dramatically higher. Acetylcholine levels naturally decline with age, and when anticholinergic drugs are added into the mix, the effects can be disastrous. Studies have shown that older adults who regularly use these drugs have a significantly increased risk of developing dementia. One of the most cited studies, published in JAMA Internal Medicine, followed more than 3,000 adults aged 65 and older for over 7 years. The findings were startling. Those who used strong anticholinergic medications daily for 3 years or more had a 54% higher risk of dementia compared to those who didn't. What makes this especially frightening is how commonly these drugs are used without a second thought. A senior might take an antihistamine for seasonal allergies, unaware of the cognitive price they might be paying. Or they might be prescribed a bladder medication to improve their quality of life, not knowing it could be impairing their memory over time. And the danger doesn't stop at prescription drugs. Over-the-counter medications with anticholinergic properties are just as risky, and often taken casually without any medical supervision. Even worse, patients are frequently prescribed more than one anticholinergic medication at a time, compounding the risk. This cumulative effect, referred to as the anticholinergic burden, is one of the clearest predictors of cognitive decline in older adults. What can be done? First, awareness is key. Seniors and their caregivers should carefully review medication lists with pharmacists or geriatricians, looking specifically for anticholinergic agents. Alternatives exist for most of these drugs, ones that don't carry the same neurological risks. Second, if such medications are absolutely necessary, they should be used for the shortest duration possible and at the lowest effective dose. It's also important to keep an eye out for early warning signs, sudden forgetfulness, confusion, trouble following conversations, especially if a new medication has been introduced. Brain scans from several studies show that anticholinergic use can lead to smaller brain volumes and decreased activity in memory-related regions. In other words, this isn't just theory, it's happening inside the brains of real people. For seniors trying to maintain independence, clarity of thought, and memory, avoiding or minimizing anticholinergic medications may be one of the most important health decisions they make. The message is clear. What you take to ease discomfort today shouldn't steal your memories tomorrow. Speak with your doctor. Ask questions. Because with anticholinergics, what you don't know can hurt you, and your mind. Benzodiazepines, the sleep aid that may steal your mind. For millions of seniors struggling with anxiety, insomnia, or muscle spasms, benzodiazepines have become a nightly ritual. Medications like lorazepam, Ativan, diazepam, Valium, or the widely known alprazolam, Xanax. They're often seen as quick fixes, offering the promise of peace, sleep, and calm in a restless mind or aging body. But beneath their calming surface lies a threat that has alarmed neurologists and geriatric specialists for years: the link between long-term benzodiazepine use and cognitive decline. These medications work by enhancing the effect of gamma-aminobutyric acid, GABA, a neurotransmitter that slows brain activity. This is why they're so effective in reducing anxiety or promoting sleep. But that same slowing effect can extend to key areas of the brain involved in memory, decision-making, and alertness. Over time, and especially in older adults, This suppression doesn't just wear off, it accumulates. The result is a foggy mind, slower reaction times, confusion, and in many cases, symptoms indistinguishable from early dementia. Several peer-reviewed studies have drawn a clear line between benzodiazepine use and an increased risk of developing Alzheimer's disease. One such study, published in the journal BMJ, found that seniors who had taken benzodiazepines for more than 3 months had up to a 51% higher risk of developing Alzheimer's compared to those who had never used them. What makes this even more alarming is the fact that many seniors are prescribed these drugs for years, often without re-evaluation. The brain, especially in aging adults, doesn't bounce back from prolonged chemical suppression. Memory lapses that seem minor at first can escalate into full cognitive impairment. And when benzodiazepines are combined with other medications, like opioids, muscle relaxants, or antihistamines, the sedative effects multiply, increasing the risk of falls, hospitalizations, and deeper cognitive issues. Even more concerning is the fact that many seniors are never informed of these risks. Doctors may prescribe them after a single sleepless night or a stressful event without outlining the long-term consequences. Some seniors end up dependent, unable to sleep or feel calm without them. This dependency often masks itself as a necessity, making discontinuation feel nearly impossible. Yet withdrawal from benzodiazepines can be just as dangerous if not managed properly. Symptoms include rebound insomnia, heightened anxiety, muscle twitching, and even seizures. The key is tapering under medical supervision and seeking alternatives. Cognitive behavioral therapy for insomnia, CBTI, meditation, guided breathing techniques, melatonin supplements, and lifestyle changes have all been proven effective in managing sleep disorders and anxiety without impairing cognitive function. In fact, studies show that CBTI is more effective in the long term than sleeping pills, with none of the brain-related side effects. Seniors who are already taking benzodiazepines should not panic but instead speak with their doctors about whether continued use is appropriate. Regular cognitive assessments, memory screenings, and medication reviews are essential for those on long-term regimens. Caregivers, too, should be aware, observing for signs like increased forgetfulness, trouble forming new memories, or daytime drowsiness. Benzodiazepines were never meant to be lifelong solutions, and in seniors, they may rob the very mental clarity these individuals strive to maintain. Aging with dignity means keeping the mind sharp, the thoughts clear, and the memory intact. That goal becomes far more achievable when we take a critical look at what we're putting into our bodies each night. Benzodiazepines may offer a quick escape from anxiety or sleeplessness, but in the long run, they may cost far more than they give. For seniors determined to protect their brains, asking hard questions about these little pills is not just wise, it could be life-changing. Statins and cognitive fog. Are cholesterol drugs clouding your brain? Statins have long been hailed as miracle drugs in the fight against heart disease. Prescribed to lower cholesterol and prevent cardiovascular events, they're among the most commonly taken medications by seniors across the globe. Names like atorvastatin, Lipitor, simvastatin, Zocca, and rosuvastatin, Cresta, are well known to many households, especially those trying to manage high LDL cholesterol levels. But in recent years, concerns have emerged linking statin use to memory loss, mental fog, and even confusion, sparking a heated debate within the medical community. The FDA has gone as far as issuing warnings about potential cognitive side effects of statins, noting reports of memory lapses and forgetfulness in some patients. Although these symptoms are typically said to be rare and reversible, the reality for some seniors tells a different story. Many older adults report experiencing an inexplicable haze, a sense that their thoughts are slower, names harder to recall, or concentration more difficult, shortly after beginning a statin regimen. In some cases, these symptoms are so severe that patients stop the medication, only to feel their mental clarity return within days or weeks. The scientific research remains mixed, but the anecdotal evidence is hard to ignore. One hypothesis revolves around the essential role cholesterol plays in brain function. While we often hear about cholesterol as the villain in heart disease, it's also a vital component of the brain's structure, especially in the formation of synapses and the insulation of neurons. The brain, in fact, contains about 25% of the body's total cholesterol. When statins lower cholesterol systemically, they may inadvertently reduce levels in the brain as well, particularly if they cross the blood-brain barrier. Lipophilic statins like simvastatin and atorvastatin are especially capable of penetrating this barrier, which could explain why some users report more pronounced cognitive effects with these specific medications. Furthermore, statins can interfere with the production of coenzyme Q10, a compound critical for cellular energy and mitochondrial function, both of which are necessary for brain health. A deficit in coenzyme Q10 may lead to fatigue, muscle pain, and mental sluggishness, symptoms many seniors attribute to aging, but which could be side effects of their medication. Some neurologists caution against the casual dismissal of these effects, arguing that for older brains already vulnerable to degeneration, even small reductions in cognitive performance can lead to significant quality of life issues. What complicates the issue is the variability in how people respond. While some experience no issues at all, others find their cognitive function noticeably impacted. This has led to calls for more personalized approaches to cholesterol management in seniors, strategies that weigh cardiovascular risk against cognitive well-being. It's important to note that statins do save lives, especially in patients with a history of heart attack or stroke. But for those using them preventively or with only moderately elevated cholesterol levels, the benefits may not always outweigh the risks, particularly if cognitive side effects are suspected. Seniors and their healthcare providers should maintain open lines of communication. If mental fog, memory issues, or confusion arise after starting a statin, it's crucial to track the symptoms, review the medication type and dosage, and explore alternatives. Sometimes switching to a different statin, preferably a hydrophilic one like pravastatin, or lowering the dose can resolve the issue without compromising heart health. In other cases, dietary adjustments, exercise, and supplements such as omega-3s or coenzyme Q10 may offer support for both cardiovascular and cognitive function. Statins are not inherently dangerous, but their use must be carefully calibrated in the aging population. Cognitive clarity is not a luxury, it's a foundational part of independence, communication, and joy in later life. If a medication intended to protect your heart is quietly clouding your mind, it's not a trade-off you should have to accept. The goal is total wellness, and that means treating the body without harming the brain. Antidepressants, emotional relief at a cognitive cost. Depression is not exclusive to youth, it affects millions of seniors worldwide, often in silence. With the loss of loved ones, declining health, and increasing isolation, emotional distress in old age can be profound. Antidepressants have provided relief for many, offering hope and balance where darkness once loomed. However, while these medications may ease emotional pain, they are not without consequence, particularly for the aging brain. Certain classes of antidepressants, especially tricyclics like amitriptyline and imipramine, as well as some selective serotonin reuptake inhibitors, SSRIs, have been associated with cognitive impairment in older adults. These drugs can interfere with neurotransmitter balance, blood pressure regulation, and even sleep architecture, all of which play pivotal roles in memory and cognitive processing. Tricyclic antidepressants are particularly notorious for their anticholinergic properties, the same mechanism of action we discussed earlier that disrupts acetylcholine activity in the brain. This can lead to problems such as confusion, blurred thinking, and memory lapses that are often mistaken for early signs of dementia. Many seniors already have lower levels of acetylcholine due to natural aging, and when a drug further diminishes this vital chemical, the consequences can be swift and serious. While SSRIs are generally considered safer, not all are created equal. For example, paroxetine, Paxil, although effective for treating mood disorders, also exhibits anticholinergic activity and has been linked to cognitive side effects in seniors. Beyond memory loss, some users report difficulty concentrating, episodes of disorientation, or feeling emotionally flat, a troubling sensation that strips joy and connection from daily life. The real danger emerges when these symptoms go unnoticed or are misattributed to aging rather than the medication. Depression in older adults can look different than in younger populations, manifesting more through physical complaints, fatigue, or withdrawal rather than sadness. As a result, antidepressants are sometimes prescribed without proper psychological assessment, and in some cases, they are continued indefinitely with little to no follow-up. This long-term exposure increases the risk of cognitive decline and may also interact dangerously with other common medications taken by seniors. Polypharmacy, the practice of taking multiple drugs at once, further complicates matters. When antidepressants mix with sleep aids, anti-anxiety medications, or even blood pressure pills, the cumulative impact on the brain can be devastating. Another lesser-known factor is hyponatremia, a condition where the blood sodium level becomes abnormally low, which has been linked to some SSRIs. This condition can lead to confusion, reduced consciousness, and in severe cases, seizures or coma. Seniors are particularly vulnerable due to reduced kidney function and overall physiological reserve. But not all news is bad. For seniors battling true clinical depression, appropriate treatment remains essential. The key is careful monitoring, regular reassessments, and consideration of non-pharmaceutical alternatives when possible. Psychotherapy, especially cognitive behavioral therapy, has proven effective in treating depression in older adults and carries no cognitive side effects. Group therapy, community engagement programs, light therapy, and even structured physical activity can all serve as adjuncts or alternatives to medication. If medication is necessary, choosing the right one matters. Drugs with a lower anticholinergic burden and fewer sedative effects should be preferred. The goal should always be the lowest effective dose for the shortest necessary duration. Caregivers, too, must remain vigilant, observing changes in mood, alertness, and memory. When an elderly loved one seems different, dulled, or emotionally distant after starting a new medication, it's a sign to reevaluate. Antidepressants are powerful tools, but they must be used with precision and caution. In the quest for emotional wellness, we cannot afford to sacrifice cognitive vitality. After all, the mind is not just a place of thought, it's where memories live, where joy is stored, and where identity resides. Protecting it must remain a top priority. Antipsychotics in seniors, misused and overprescribed. Antipsychotic medications were originally designed to treat severe mental illnesses such as schizophrenia, bipolar disorder, and acute psychosis. They include drugs like risperidone, olanzapine, quetiapine, and haloperidol, potent agents capable of calming delusions, stabilizing mood, and managing dangerous behaviors. But over the past 2 decades, their use has expanded far beyond their intended scope, especially among seniors. In many long-term care facilities and hospitals, these medications are prescribed off-label to manage behavioral symptoms of dementia, agitation, insomnia, or even simple resistance to daily routines. What was once a last resort treatment has, in some settings, become a tool of convenience, and the consequences are alarming. Antipsychotics significantly alter the brain's neurotransmitter systems, particularly dopamine and serotonin, which are essential not only to mood regulation but also to cognition, motor control, and motivation. When used in seniors, these drugs can cause profound sedation, motor stiffness, confusion, and an increased risk of falls. But perhaps the most insidious effect is their long-term impact on cognitive function. Studies have repeatedly shown that elderly patients who are given antipsychotics, especially those with no underlying psychotic condition, are at a much higher risk of experiencing accelerated cognitive decline. A study published in JAMA Neurology found that older adults using antipsychotics had a more rapid progression of dementia symptoms compared to those who were not. This is not just correlation. It's been linked to drug-induced damage to key brain regions associated with memory and executive function. Furthermore, these medications come with an FDA black box warning. They increase the risk of death in elderly patients with dementia-related psychosis, primarily due to heart failure, sudden cardiac death, and infections such as pneumonia. Despite this, antipsychotics remain commonly used in nursing homes and hospitals to subdue challenging behaviors, often without the informed consent of patients or families. This practice, known as chemical restraint, raises ethical concerns and reflects a deeper systemic issue, one where overworked staff and limited resources lead to pharmaceutical shortcuts at the expense of patient well-being. Seniors on these drugs often appear dulled, withdrawn, or zombie-like, and loved ones may mistakenly assume these changes are a natural progression of disease rather than a side effect of medication. In cases where antipsychotics are absolutely necessary, such as in acute psychosis or when there is a clear, immediate danger to self or others. They should be used sparingly and with close monitoring. The dosage should be the minimum required, and efforts should always be made to taper off as soon as it is safe. For seniors with dementia, non-pharmacological interventions should always come first. These include music therapy, memory stimulation, consistent routines, environmental adjustments, and caregiver education. Numerous studies have demonstrated that behavioral symptoms can often be reduced without medication when proper support systems are in place. Another often overlooked issue is the combination of antipsychotics with other sedative drugs. When taken alongside benzodiazepines, sleep aids, or certain antidepressants, the cognitive effects multiply, pushing fragile minds further into confusion and dependency. Seniors who start antipsychotics may become less mobile, less communicative, and more prone to withdrawal, creating a downward spiral in both physical and cognitive health. Families and caregivers must advocate strongly when these medications are proposed, asking clear questions. Is this drug truly necessary? What are the non-drug alternatives? How long will it be used? Are we monitoring for side effects? The goal must always be to preserve as much cognitive clarity and quality of life as possible. While antipsychotics have their place in medicine, their casual use among the elderly carries risks that far outweigh the convenience they may offer in the short term. For seniors and those who love them, awareness is the first step towards safer, more compassionate care. Medication should heal, not silence, and when it comes to protecting the aging brain, that distinction is everything. Over-the-counter risks, everyday drugs with hidden cognitive dangers. When most people think about medication-related memory issues, their minds often go to prescription drugs, the pills that come with long inserts full of warnings and side effects. But some of the most dangerous culprits when it comes to cognitive decline in seniors are hiding in plain sight, over-the-counter medications. These drugs are easily accessible, heavily marketed, and frequently used without a second thought. Yet their impact on the aging brain can be profound. One of the biggest offenders is diphenhydramine, the active ingredient in many popular sleep aids and allergy medications like Benadryl, Tylenol PM, and Unisom. As a first-generation antihistamine, it has strong anticholinergic properties, meaning it blocks acetylcholine, a neurotransmitter vital to memory and learning. For seniors, who are already dealing with age-related reductions in acetylcholine, this can be a cognitive double whammy. The short-term effects might appear as drowsiness or mental fog, but with chronic use, the risk of long-term memory impairment and even dementia significantly increases. Studies, including those published in journals like JAMA Internal Medicine, have shown a clear association between prolonged use of over-the-counter anticholinergic medications and increased incidence of Alzheimer's disease. What makes this even more dangerous is how these medications are marketed. A bottle labeled non-habit-forming or safe for daily use can mislead consumers into long-term, unsupervised usage. Seniors looking for a better night's sleep or relief from sinus pressure may not realize they're quietly degrading their brain's ability to think, remember, and focus. Another common risk lies in NSAIDs, non-steroidal anti-inflammatory drugs, such as ibuprofen and naproxen. While not traditionally linked to cognitive impairment directly, chronic use of NSAIDs has been associated with an increased risk of cardiovascular events, kidney dysfunction, and even internal bleeding, all of which can indirectly contribute to cognitive decline. A compromised circulatory system means reduced oxygen flow to the brain, and impaired kidney function can lead to toxin buildup, both of which degrade mental performance over time. Additionally, combining multiple over-the-counter medications can create unintended interactions. For instance, someone might take a sleep aid containing diphenhydramine along with a cold medicine that includes the same ingredient, unknowingly doubling their dose. This can intensify the sedative and cognitive side effects, especially in an already vulnerable older brain. The cumulative effect of these drugs can be just as dangerous, if not more so, than any single prescription. Seniors often juggle multiple health concerns, and with every added pill, the risk of drug interactions, confusion, and mental dullness increases. Caregivers and loved ones might notice changes in personality, speech, or memory and mistakenly assume it's the natural course of aging when in fact it's a preventable reaction to over-the-counter medications. It's also important to recognize that over-the-counter doesn't mean oversight-free. Just because a drug doesn't require a prescription doesn't mean it's harmless. The regulatory standards for OTC medications are different, and long-term studies on their impact, especially in seniors, are often lacking. That makes education and self-advocacy crucial. Seniors should be encouraged to bring all of their medications, including OTC drugs and supplements, to every medical appointment. Doctors and pharmacists can review these together, identifying any red flags and recommending safer alternatives. There are many non-drug strategies for managing the issues these medications are often taken for. For allergies, newer generation antihistamines like loratadine and cetirizine have far fewer anticholinergic effects. For sleep, cognitive behavioral therapy, mindfulness practices, or simple sleep hygiene adjustments can make a huge difference. And for pain, strategies like physical therapy, gentle movement, and anti-inflammatory diets may reduce reliance on NSAIDs. The key message is this: don't let the ease of access fool you. Over-the-counter medications can be just as powerful and just as risky as anything behind the pharmacy counter. For seniors seeking to preserve not just their physical health, but their mental sharpness and independence, it's critical to scrutinize every pill, every label, and every routine. In the fight to protect our minds, knowledge is not just power, it's protection.